about pellets. What are the pellets? And it's a different way of delivering bioidentical hormones. Remember, bioidentical hormones are hormones that are identical to your hormones that your body produces. But this way, it's a way of introducing or delivering the hormones in a more physiological or more natural way. And these are what we call hormone pellets. Remember, hormones are very, very important. We have to have an assessment as to what symptoms people are having and do a full analysis on the blood work. And then that way we know how much to give and what to give as far as hormones. And one of the ways we can do that is through pellets. Pellets are a sterile, compressed form of hormones that are looked as the size of a rice, grain, very small, or maybe a small, like a tic tac, And what we do is we're able to introduce that in the upper left or right buttock region, and sometimes in the men it's more in the flank because that's an area where there's some fat, and we can put it right over the muscle. And what we do is we clean the area sterilely, almost like a surgical procedure, make sure it's sterile with a special type of iodine. And then we numb the area with lidocaine, and we make a very small incision, about 3 or 4 millimeters. And then we're able to introduce or slip in the pellets right under the skin, usually about less than half an inch into the skin, or right in the fat tissue, right over the muscle, or right over the gluteal region, or the muscle in the butt. And generally, it takes within 3 or 4 days, that incision is basically healed up. There's no need for stitches, just steri strips. We put like a special dressing on it so it doesn't get wet for a few days. And we just ask people not to do any heavy leg exercises like squatting for the first week, because we don't want them to push them out. And what's really good about these pellets is that your body develops capillaries, like little blood vessels around the pellet, around this little rice grain, And what happens is your body starts just releasing or getting the hormones as it needs it, So it's like a little storage of the hormones. And in these pellets, we're able to put estrogen, progesterone, testosterone, and estradiol, which is an estrogen blocker, which prevents testosterone from converting to estrogen. So it takes away the need from having to take pills, gels, injections, and it's very convenient because people can travel and they don't have to travel with creams. They don't have to travel with like needles or syringes or vials of testosterone. So we can do it for both men and women.